I don't think we have any first timers or even second timers on this call, do we? Ed, keep your hand down.
I'm second time.
Very good. Now, Liz, you said something here that, are we going to announce Adam's Stretch Lab demos at this point? Or are we also doing that at the end?
Well, maybe we'll let, if that is Adam on there, maybe we'll let Adam do that a little later.
Great.
It's up to you. You are the host today.
It's a dark screen. I can't tell if Adam's with us or not. Is this Adam? No answer. All right, we'll get back to the Stretch Lab announcement then. And without any further ado, I'd like to connect everybody with Dr. Rami, who actually, right when moving into Lake Oswego, came out and visited Christine and I at the studio and introduced himself and let us know about his services and everything. So I'm incredibly happy to turn the microphone over to Dr. Rami and his Back and Line Chiropractic.
Thank you so much. All right. I'm going to share the screen with you guys. Can everybody see it? Perfect. Okay. So my name is Dr. Rami. I'm the chiropractor and the owner of Back and Line Chiropractic and Wellness. And this is my clinic motto. Chiropractic is a healthy lifestyle success strategy. I believe chiropractic should be going hand in hand with your everyday activities, with athletic activities, to keep your spine and your nervous system working optimally, so you don't have any problems, you don't have any injuries in the future. We are located on 2nd Street, right under Chrisman Frame Shop. That's where the entrance is. Most people, they get confused how to enter it. So you just go there and you turn left, and that's where you find my door. Okay, so that's our team. We have a chiropractic, we have acupuncture, and we have fitness and nutrition. The lady on the right is Hannah. She's our wonderful acupuncturist. The lady on the left is Cassie. She's our fitness and nutrition coach. And that's me in the middle. I'm the chiropractor and the owner. That's sharing a couple pictures with you guys of my clinic. On the left is the front desk area. On the right is the hallway to the acupuncturist room and the bathroom and the massage room later on, hopefully. And the pictures on the left are my chiropractic room. The one on top right is the acupuncturist room. And right bottom is where Cassie does her fitness consultations, and we show patients exercises to help them stay healthy. So what do you expect when we come to Back in Line? So if you have an injury, if you're suffering from an injury, whether it's a car accident or a sports injury or any acute pain, we take you through a full consultation, and we do postural analysis and range of motion assessment, neurological screening, muscle and function assessment, orthopedic exam, and chiropractic exam. I'm going to go through those in the next slides. If you don't have an injury, if you're just coming in for wellness care, we do just screen for contraindications. We review your past medical history, your family medical history, making sure that you don't have any red flags for chiropractic or acupuncture treatments. So our consultation, during the consultation, we learn more about your condition. So we ask you a lot of questions about how it happened, how did you hurt yourself, what positions causes more pain. The consultation, you expect like 101 questions. We need to really know what happened and what is the cause of your problem. And then we review your medical and past history, for your family, for yourself, and we need to learn more about your goals. So intermediate goals and the long-term goals, what you want for now and what you want in the future. How this injury or the symptoms, how this affected your life and where you want to be. We need to know your long-term, like the things that prevent this injury, prevent you from doing and you would like to go back to doing. So that's my my ultimate goal, not only to get you out of pain and get you out of the symptoms that you're having right now, but to get you to where you want to be health-wise. And during the consultation as well, you'll get more information about subluxation and how it affects your body, how it affects your spine, your nervous system, and how chiropractic can help. Our posture analysis, we use a program called Posture Screen. Posture is very, very important and play a huge role in health of your spine and joints. If you don't have good posture, your muscle get stretched out or get tightened out, so you have muscle imbalances. Your ligaments, the same thing, they will get weakened and stretched out, and that will affect the integrity of your joints, of your spine. And bad posture can lead to spinal degeneration and osteoarthritis much faster than what's supposed to be. For every visit or for every patient, when they come in, we do a postural analysis, and we do another one on each reevaluation, which is probably every month or every 6 weeks. So for the range of motion assessment, we assess the range of motion of your lumbar spine, your torso, and your neck, and see if there's any restrictions, limitations, pain, stiffness, or if you have hypermobility. Also, if you have like a lot of range of motion, that's not something that's super good. A lot of people, they are super flexible, and that causes the joints above and beyond to have more stress on them. So we need to make sure that all the joints are moving well, not just 1 or 2 segments. The neurological screening, we do just basic screening if you don't have any neurological symptoms. So we screen for light touch, for your reflexes, and for your muscle strength. But if you do have neurological symptoms, we do more in-depth neuro examination to tease out any nerve involvement or any central nervous system involvement as well. For the orthopedic and the chiropractic exams, that's like cluster of examinations of your joints, of your muscles, of range of motion, and a lot of chiropractic examination as well to see where the segments that's stuck and they're not moving and how it's affecting other part of your body. And at that time, we make referrals if needed, whether for x-rays, MRI, or to see a different provider to coordinate care at that time too. Spinal manipulation, most people know the cracks that chiropractor do. So what spinal manipulation does, it restores proper mobility in the spine and decreases muscle stiffness, inflammation, nerve irritation, and promote tissue healing. So when the joints don't move properly, this joint get inflamed, and that inflammation in the spine can cause irritation to the nerves around it. The muscle will spaz out to protect that joint, making it not move, so not causing pain, and that lead also to more joint restriction. So that's like a downward spiral of vicious cycle. So with spinal manipulation, we restore this motion and we allow the healing process to happen. Soft tissue manipulation, we offer percussion massage, we offer cupping, we offer scraping. And the purpose of all 3 of those is to restore proper healing to the muscles. So we direct our soft tissue work on, first of all, the fascia. If there's any fascial adhesion, which is scar tissues, like the fascia will get stuck to the muscles, and that will cause a lot of muscle stiffness. So first thing first, we make sure that we don't have any scar tissues or fascial adhesion. So that's where scraping and cupping come along. And scraping and cupping as well promote healing by bringing more blood flow to the area. Then we do some percussion massage to loosen up the muscles, and that will make the adjustments much easier and would hold the benefit of it for longer time. We also implement modalities, which is ultrasound and interfacial currents, which is IFC. The ultrasound allow deep heating of the tissue, especially ligaments and tendons that normal heating pads cannot penetrate that deep. And that will promote the healing, bring more blood flow to the area, and will relax the tissue, the injured tissues as well. For the IFC looks like the TENS unit, but the IFC penetrate deeper than the TENS unit, and it does the same thing. So it will block the pain, relax the muscles, bring more blood flow to the area on a deeper level. So also we implement both of these to promote the healing and expedite the healing of the tissues. For our report of finding, so we do that usually the next visit after I put all the exam findings together. The patient comes back and we explain the condition. We explain things that we can do to help, things that the patient can do to help themselves at home so they don't have the problems anymore, and to help with the healing process. And we put the treatment goals and outcome measures based on the patient goals and our outcome measures, which is what we find and what we need to work on. And we put recommendations to do at home, whether to change your posture as you sleep or as you sit, or how to get in and out of the car, or how to lift. Like we give you a recommendation so you don't injure yourself further when you go home. And we give you home exercise programs. So all this information will be emailed to you, detailed with all the recommendation and explanation for your condition and everything. And then you'll have an access to a portal, so you can go in and you can see the exercises that are prescribed to you in videos. And just in case you don't know how to perform it, you can just see in videos, somebody will explain it and you can perform it at home. So we have 3 phases of care that we believe in our clinic. So the first phase is the relief care, which is our goal to reduce your pain, because most people will come with pain and inflammation. So we reduce the pain and the inflammation, and we prevent further damage. So we stop the inflammation and the damage process in the joints or the problem area to start the healing process. That will take usually 4 to 12 weeks, depends on the case. And I recommend seeing the patients 2 to 3 times, also depends on the case, per week. Then after the first reevaluation, we see if we can go to the second phase, or the corrective and restorative phase. And the focus on that is improving the joints and nerve function. So at that time, with the exercises and with the recommendations that you do at home, we make sure that you don't go back to the bad posture or the bad motions that caused the injury in the first place. Also, this will go for another 3 to 6 months to make sure there's a proper healing and proper restorative of the function of the joints and spine. And we see you between 1 to 2 a week, depends on the case. And then we do another reevaluation at the end of that. And that's when we graduate our patients to the wellness care, where they come like once a month or once every 6 weeks, depends on the case and depends how active they are. And the goal there is to improve the health, prevent pain, and prevent further injuries, and improve the quality of life overall. So our initial exam and first examination or first treatment is $150, and that just the first one. And then the follow-up visits will be $75, including the reevaluation. So I don't charge for the reevaluation. It will be incorporated in the follow-up visits. But if you don't have any injuries or conditions, or you're only coming in for wellness or maintenance care, we do offer wellness membership and packages. So for the wellness visit by itself, just one, is $60. And that's usually goes for 10 to 15 minutes. We do soft tissue and we do spinal manipulation. But we offer also the wellness plans. So you pay $140 a month and you get 4 visits. So that will drop your cost per visit to $35, saving $100. And if you need additional visits, you can purchase them at rate of $25. And we also offer prepaid packages. So we offer 6 visits that will expire in 6 months, and you pay $270. So the cost per visit is $45, so you're saving $90. For 10 visits, they will expire in a year or 12 months, and you pay $400. Cost per visit is $40, and you're saving $200. And the best value is the 20 visit expires in 1 year, because it will drop the price back to $35. So you're saving $500. And we also always offer free initial consultations. So anybody who want to come in and learn more about our services and want to see how we can help them, it's free of charge. And if they decide to go with us, we will offer them whether they want to buy the wellness package or the wellness plan, or if they have an injury, they can go with the treatment plans. This is our contact information. And that will be it. Thank you so much.
Thank you so very much, Dr. Rami. That was incredibly comprehensive.
Thanks.
Before we split out into small groups and hear Liz's announcements, does anybody did that bring up questions for anybody for Dr. Rami?
I have one.
Yes, Tanmaya.
I'm just curious, Rami, what brought you to chiropractic work? Like, why did you decide to go into being a chiropractor?
That's a good question. So I came from Syria. I'm a dentist over there. I graduated. I came here with my wife. I would try to pursue dental school. So in 2007, I got into a car accident and I went to a medical doctor and they were giving me medications, muscle relaxers and ibuprofen and stuff like that. There's not much improvement there. Somebody suggested to go to a chiropractor, which I've never heard of before because we don't have chiropractors back home. So I went to the chiropractor, they went through the whole examinations, x-rays, and they adjusted me, they did some soft tissue work, and I felt like $1 million almost immediately. No medication, no nothing. And he was like, come back next week, we'll do the same thing. I was like, you're not prescribing me anything? He was like, no. So I was like, what is this? So I tried to learn more and more and more about chiropractic and fell in love with it. So I decided to quit my job and go to chiropractic school.
Awesome. Thank you. That's
Nice.
an inspiring story.
Absolutely. Liz, do you have some chamber announcements for us?
I have just a couple of announcements. The Chamber is pursuing a grant to become a business recovery center for Lake Oswego and West Lynn. It's a partnership. We won't find out till next week if we get the grant, but if we do, we will have 1 or 2 full-time jobs at about 20 an hour for the months of November and December. So if you know of somebody who has great marketing experience, knows social media, or knows our business community well, it's a short-term job, but just send me their name and their contact information so that if we get the grant, we're ready to call people immediately next week. Thank you so much.
Fantastic. Thank you very much, Liz. And again, Dr. Rami, thank you for presenting today. We have an additional announcement from Adam at Stretch Lab. Adam, would you like to come off mute?
Absolutely. Hello, everyone. I want to let everyone know that next Friday from 10 a.m. to 1 p.m., we will be offering free demo stretches at the Chamber office, at Central office there in downtown Lake Oswego. So I'm going to be sending a sign-up sheet. We'll be able to accommodate, let's see, I guess 3 people per hour. So I'll send a sign-up sheet to Liz, and so just contact Liz and sign up for a specific time slot, and we'll be offering free stretches from 10 to 1. So feel free to give her a call and sign up, and we'd love to come stretch you out.
Awesome. Very cool. Thank you, Adam. And then just a show of hands, I know we've got one potential shout out for after our small groups. Do we have anybody else has a shout out for other members of our community? I've got to scroll back and forth between 2 screens.
Yeah.
Rami has one, Tanmaya has one, and okay. Well, fantastic. Let's close out our meeting with those and have Liz break us into some small groups now.
All right, I'm going to be sending you into 4 small groups. We'd like somebody in the group to make sure everybody gets a chance to speak, and 1 person will report out at the end. And with that, here you go into the small groups. And are we missing anyone here? And Adam, I am going to get you sent to a small group here. We'll figure out just a minute. Oh, Stephanie came on. Okay. How do I get you added to here? Just a moment. Oh, there we are. I'm getting Diana's going to 1, and Stephanie is going to 3, and Adam is going to, there we go. And Diane, you'll need to, I think, click on something to get to your breakout room. All right, 8:31.